how do people optimize treatment? What are the best things that people can do once sitting in a chair, going through the process? Are there things that they should be doing to help the technology?
Absolutely, right? I think there are a lot of things people can do to optimize TMS. TMS itself, as you know, you've done tons of patients, is amazing, amazing technology.
Yep.
So effective, twice as effective as medications. But I think we have to remember we're humans, right? And we even think of all the illnesses we treat, whether it's depression, OCD, anxiety, they're multifactorial in their etiology, right? This is why we always talk about biopsychosocial, environmental, spiritual impacts. And so I think that I truly feel it's a shame when you have an individual coming right to you and you have them there in your chair, 20, 30 minutes a day, 5 days a week, sometimes now coming multiple times a day when they can do that. And you don't take advantage, right, of all the ways you can optimize the success of the treatment. So certainly, I think while in the chair, making sure you have a tech at your office, right, that's very attuned to the client and talking to them about their life, giving them tools just of that human experience, right? We have a very set, at Neuro Wellness Spa, we have a very set protocol and we pick a topic every week. Obviously, we personalize it if it's not relevant to the person, but we go through sleep hygiene, we go through nutrition. We go through exercise or movement. Some people hate the word exercise. So
people hate
natural movement, right?
Yes.
Hike, swim.
Yes.
We do sort of just community engagement. Important sense of purpose.
Okay.
Yeah. And so I think talking about all
Is that
of
really
those,
what you wanted to say there?
What important sense of purpose? Yeah. Came a little bit of alliteration, but yeah. No, but I think a sense of purpose is really important. Right?
I agree with you. Spirituality.
But I heard, I thought you were going to hear, you agree with me, but.
No. I won't butt you. And I say that because a very smart woman one time told me the pillars of life, right? Diet, exercise, community, spirituality.
There you go. Yeah.
That was you.
Yes. Oh, well, that was
That
nice.
was you.
I do think it's really important. Right. We lost a lot of that in Western medicine. And I think the idea of spirituality, people moved away, I think, for fear. It's very different from religion, right? But the idea of who am I? Who am I in this world? What's my meaning here? And what purpose do I serve? And I think when people have been depressed, particularly for a long time, sometimes they have lost that. Right. They've lost that sense of self. And I don't know, that's what motivates me. I mean, you were just saying, right? Like if you help one person, think how lucky we are. Like we probably help at least one person every day. Yeah. But how so
blessed.
Feels so good, right? Just think, so that people that feel like, just help one person, right? It's huge, but that's such a sense of meaning and purpose. Like I love what we do.
Right.
It's crazy amazing to feel like we impact people, we change their lives, the quality of their lives.
The quality.
And
the sustainability. That's the one thing that I love is how long the effects of this last. And that's why I do think this question is important, because if you just get in a chair,
right?
Yeah. You just come, you get in a chair, you're going to leave, you're going to feel better. Great.
Right.
How long is it going to last?
Yeah.
But if you're exercising, moving, how much better are the results?
Yeah, much better, right? We know that. I think in general with TMS, we know standard 80% of people, right, will stay in remission after a year. But yeah, you and I see the individual people in there, and the ones that do the best are really approaching life with a really holistic approach. And I think it's just like, you can make a bunch of analogies, right? I can show up at the gym every day and maybe just go on the arm machine, right? Or the weights for the arms, right? Or go on the treadmill.
Right.
But how much better, right, do I get when I'm using everything that's available at the gym? And then I'm going home and I'm eating well and I'm making sure I have a good night's sleep and I'm socializing, right? And I'm watching what I'm putting in my body in terms of drugs and alcohol. You can't compare. So, yeah.
On the topic of the drugs and alcohol, should one stay away from TMS if they're suffering from those addictions?
I think not at all. I think that we know TMS is super helpful for the brain in terms of recovery.
Hmm.
I think it's just about approaching it wisely, right? Obviously, there's certain risks. So I was reading an interesting, an article just came out in JAMA about cannabis use disorder,
Okay.
and that there's a 3 times higher likelihood of death in the 5 years after somebody shows up in the ER with a diagnosis of CUD, cannabis use disorder, 10 times likely to die from suicide. Crazy, right? So that's an example for me is we treat
Wow.
people, I know, it's amazing,
I didn't
right?
see that, but that's fascinating.
Yeah. I was blown away. I never would have thought the stats were that high.
Right.
Naturalistic study, like looking at ER, thousands of patients. But I think the idea is like, so we know those patients. We can identify those patients who are using substances, I think, as more of a self-medication to help with symptoms of depression, anxiety. And those who have that, I believe it's always dual a diagnosis, right?
Yes.
But you have the addiction and the ones that we feel like we really better get them more stability, like a community, like the tools before we would add the TMS. And I think it's all about personalized care. So I've treated people that are literally they're smoking marijuana every day. And they are very motivated and they know if they were feeling better or less anxious or sleeping better, they would be able to stop. And I'm all about helping them with TMS, right? And it's a process and you're tracking it throughout.
Of course.
Things like alcohol, we have to be careful, right? Just because seizure risk and lower. So I think those people, we sort of really want to make sure they're in a good program, that they have the ability to maintain a sobriety, that they have those resources. And then adding the TMS in terms of their just repair of the brain is incredibly advantageous.
I couldn't agree with you more. I cringe when I see people saying that you shouldn't do TMS if you're drinking. There are some people that shouldn't, yes.
Right.
But I know for a fact, personally, that's why I don't drink today.
Yeah.
Is because I went through TMS, and this is not a recommendation. Because I don't think it's smart. And for the average person going through TMS, you're kind of wasting it.
Yeah, if you're drinking too much or drinking every day or it's more insight, right? If you don't have awareness, like this is a problem, right? Same thing with medications though. How many psychiatrists out there you think are giving people antidepressants and
upping their dosage during TMS?
Yeah.
It frightens me. And I think that's honestly lack of education. And just awareness.
Yeah.
Again, that goes to the personal, right? Because I sit with people and I'm not a provider. I'm a human and I sit with these people every week and I can tell like, why would you up your dose?
Right.
Your scores are dropping. TMS is trending perfectly. Why are we upping dosage? You had a bad day? Diet, how important? Obviously, we know diet is important. And I think there's a major shift in the country right now that is realizing, maybe they've known, but it's going to shift. And how beneficial is that to what we do, right?
I think it's incredibly beneficial. I don't know, I'm not an expert in all the gut microbiome and all of that.
Yes.
I am very aware like how important that is and how much more we're learning, right, about the gut. And we do know, right, more nerve stimulations come from the gut to the brain than the brain to the gut, right? And we know how important those signals are. So I think that it's going to be a very interesting part of science and what we learn from that.
Right.
But yeah, I'm involved. I read a lot about the gut microbiome and the impacts it has. And remember the old, I don't know, you're younger than I am, but it used to be the whole thing, or you are what you eat.
Yeah. I remember that.
You are what you eat. Well, like things come full circle, right? It's sort of like, well, you are what you eat, right?
You know what's funny is I haven't thought of that. And now that you say it, it's like, oh, wow, how did that come full circle? Because I do remember talking about that when we were younger.
Yeah.
Wow.
It's the same idea, right? Well,
yeah.
now it's really panning out pretty true, right? It's like those, like you are what you eat, because what's in your gut is going to your brain.
Is going to your brain.
Impacting how you feel and how you function. And probably what we're going to learn is affecting the structure of your brain too, eventually, right? We're going to know
how
that.
fascinating that is, right?
Yeah.
one of my biggest blessings that came out of the last, there was so many things that I did get walking away from our last interview. One of them was a client that saw a video on this channel and he actually reached out to Jordan,
right,
the last videographer who helped me start this channel,
right,
and found him on Instagram. And he reached out to Jordan, and lovely Jordan contacted him, contacted me, connected me, and I talked to him, and he was in your area. And so many times people have wanted to drive here and do TMS with me. And I'm like, no. You're going to pass so many great centers on the way. Like, just not do that.
Yeah.
But the gentleman, I sent him to you, and he loves to call me and leave me. It's voice text is what I do. Voice messages.
Right.
And this man will leave me like a 5-minute voice message. Okay. And I listened to him. I think I've even sent you a couple of them.
Yes, you sent me
and
one.
My heart, like what a blessing. And again, like I made that connection, right? But I really have nothing to do with this, you know?
Well, a lot to do with it, though. I say this is the collaborative care, right? We talk about, and how I said, like, there never should be competition, in my opinion, between.
Thank you.
Right? There are way many more people going to go around than we could ever serve.
Yeah.
But thank you so much for the referral. And he's been such a pleasure to treat, and done amazingly well. And it's back to your first question about what else do you do besides, not only when you're in the chair, right, but after, because it's when we're not collaborating, right, and using those other tools. So our relationships with therapists, right, our relationships with nutritionists, right, coaches. Personal trainers. Like, there's so many ways to get in. Everyone's different in what they'll do, and habits are hard to change, but I think it's a great example. So I love collaborating with you. He
messaged me last night and wished us luck today in our conversation, as he is the sweetest man. But just to see that, and like you said, like, there is no competition. When I owned my rehab, a woman who is a dear friend of mine still today,
right,
she opened the same business model on the same street. Okay. It was a long street. Thank God. But we were on the same street, and we're still dear friends today. We shared clients all the time. Hey, this one's not appropriate for me. You take them.
Right.
And vice versa. And that is something that in the medical field, I know does not happen.
Right. Doesn't happen nearly enough.
It drives me up a wall.
Yep.
And I do think that is the importance of us sitting down and doing things like this, right?
Yeah.
Clearly, we're more than a street distance away, right? But not everybody's appropriate. And having somebody drive past you to get to me hours away, it's madness. Especially when you can just pick up the phone. I think I just shot you a text too.
Yeah, you did.
Hey, have your team call this person for me. Boom.
And we did.
All done. And this man, flat out, you saved my life. You know?
It's also a good example of, though, how important it is, like, the trust in the relationship.
Yes.
Because that's,
yes.
all right. Yeah. And I think that's important too. Talk about what's going on in the chair. That's why I say, like, you go, sites where we try to match our techs with the patient so that they come in every day, right? And they're seeing the same person, and they really build a relationship over those 9 weeks. And I think there's something really valuable about that. In terms of the healing, I'm not just saying that it's nice customer service, right? But that to be seen and be heard and be understood.
Personalized care.
Yeah.
And that was the other big thing that I did take away from our discussion last time is number one, talking to you, you could get the fact how much you cared. But then it was more that you were giving everybody, no matter who they were, personalized care, right? Just like you said, they can feel heard. Because a lot of our patients don't feel heard, have never felt heard. And that's a struggle in life, right? They show what isolation does for people. If that's how you're living, and then you're going to a place and still just, you could put them in a room, you could shut the door, you could turn that machine on and let them get their treatment and help them up the chair, walk out the door. What have you helped them with? Yes, you gave them TMS. Yes,
Right.
there's benefit.
Right.
But think if you just spent a little time talking. What a
Yeah.
blessing, right?
Yeah. Yeah. And sometimes, right, what happens too, I think we as a physician, we even get to know our patients better, right?
Yeah.
Because they're more comfortable sometimes saying things, right? To the tech that they might not, right, tell us. And then we get to do
especially as
that.
it goes through the process, right? As that brain starts firing,
Yes.
and they get more comfortable, the craziest things come out,
I
and these
know.
players like, "Whoo, you didn't say all that, okay?"
Right?
But
Yeah.
like, how beautiful! Thank you for trusting me with that. You know,
Right.
I'm glad you feel safe.
Right.
It's. I mean, I was having a conversation with this woman last night. She came in after her session, 13 sessions in, and we track their scores, right? I can see the brain, I can tell it's moving and all these things, right?
Yeah.
I don't feel it. I don't feel any better. Sweetheart, you're only 13 sessions in. But shouldn't I feel it? I've heard your stories. I've watched your videos. You felt it the first day. And I'm like, I felt something.
Right.
And I never went on any video and said, I felt so good first day. I felt something. I didn't say how much I felt. What do you tell patients coming in? Well, how do you set the expectation?
Yeah.
Right? When let's do my first time in the chair. What's kind of the expectation you or your staff is kind of setting for that person?
Yeah, that's a really good question, and I think super important for patients to even understand. And you're right, we're all different. Some people do feel something right away, right? It's sort of like an SSRI, that little boost that comes out, and then we would tell people like, well, that might taper down and then get better. But so what I like to tell patients is, there's sort of the general scope of what to expect, and then we're all individuals, right? So first day you come in, right? It's going to hurt a little bit, right? Never had anybody quit because of pain, but it's I am very honest, like it's not the most comfortable feeling.
Right.
But I have had patients that come in and be like, "Oh, I like it. It feels like you're massaging my scalp." I'm like, "Wow, all right."
My daughter said that.
Okay, see?
I
It's
was
interesting.
like, fantastic.
Yeah. And other people are like, "Oh, it's a little harder than that." But I always remind them, listen, we can adjust that to make sure you're comfortable, right? But the point is to get up to an efficacious level, just like you would have a dose of a medication, right?
Right.
So to expect it to hurt a little bit. You may feel a little tired at the end of 4 or 5 treatments, right? Not so tired that it interferes with any of your activities. But a lot of people, I say the real expectation is by treatment 10, we pretty consistently see a 20 to 30% drop in their pH scores, their PHQ scores, their rating scales, their GAD-7s. And like that's unheard of, right? Even on a medication, you're not even up to a therapeutic dose at that time.
Yeah.
Now we're all different in terms of how self-aware we are and how we process that. Like your patient, right? He's like, well, 13, I'm feeling it. Yeah. So what is she expecting to feel? Is what she expecting appropriate? You know what? I learned this the other day. I didn't know this. I was listening to another talk about TMS, but you probably know this. PHQ-9 difference of 6 points is what is supposed to be clinically significant. Like, meaning that most people can appreciate a change of 6 points. I didn't know that. That was sort of just cool to know. But we usually say 10 to, we're about 20 to 30% down. If you're not, then we're looking at, look, what do we need to be doing differently?
What
like, are we
needs to change?
missing something? Like, is there something in the protocol? But people should feel that much better after about 2 weeks. Now, not being depressed isn't the same as being happy. Right. It's not. And I think that's what you have to set the expectation to, So the first 2 weeks, I'm telling people, okay, you will notice stuff. Maybe your sleep's a little bit better. Maybe you wake up, you don't feel like, you're not suicidal anymore. Maybe you wake up and you notice, oh, I have a little bit more energy. Maybe you're less tearful. Maybe you're less irritable. You are not going to be in full remission after 2 weeks, right? But then you'll notice improvement over the subsequent 6 weeks. And our goal is full remission. And I tell people, I think that's another thing in psychiatry, right? We've gone along so long with treatments that get people partially better. People settle with partially better. They don't necessarily even, maybe you lose a little perspective of, but for us, really the goal is complete remission. We know, right? It gets people like, you should feel like yourself. Like, not what I know is to you. Because I saw you when you're depressed, right? Like, do you feel like yourself again? And if not, what are we missing?
Yeah.
And if we don't get people there, they're going to have a recurrence faster. And so there's a lot of value in working that hard, I think, to get completely better.
How are you gauging remission? Help us understand remission when it comes to TMS.
So one way is the scientific way, which is to really look at the rating scales, right? And that's a standardized evidence base. If your PHQ-9 is 4 or below, you are in remission. For me, it's more what I said. Like, remission is somebody who is functioning at what they feel is a really good potential level for them.
Yeah.
That they feel they're coping, right, with life well. To me, remission isn't all your problems are solved or you're feeling happy every day. It's the springboard. Like, if you leave TMS and feel like I can handle what's coming, right, every day, because I feel I have the energy, the focus, the cognitive skills, whatever. I'm sleeping fine. That I can. To me, that's beautiful, right? I can enjoy my life and I can handle and cope well. To me, that's remission.
I couldn't agree more.